Fat removal, liposuction surgery is, as the name suggests, a surgery. Naturally, there are specific risks associated with certain potential complications. I am always in the office. When patients ask me questions during an examination in my clinic, I am the one who tells them plus or minus everything about whatever surgery is to be done. And I really like this style of mine. If so, when even walking on the street, is this risky? Of course, liposuction surgery, fat removal, has its risks too. Sometimes patients are very afraid to hear these words. They are very hesitant. If the surgeon you have selected, the doctor you chose, is diligent and extremely precise, if he is not a physician who values his work, there is even a risk of death. But please remember this. I do not wish for you to develop the impression that every single patient undergoing liposuction here faces a risk of death. I sometimes use this example and I like it a lot. No matter where you are in the world, there is a risk of a car hitting you while walking on the street, while walking on the sidewalk. There's a risk of a brick falling on us on the sidewalk. There's a risk of a window falling on us while walking there. All of these, when we look at them proportionally, are very low risks. The risks in liposuction surgery are essentially a complication risk even lower than these accidents I mentioned. However, a lot depends on the surgeon here. For example, in interviews, I said I don't do liposuction for weight loss. My main reason for not doing it is this, viewers. In my own experience, the healthy limit and maximum I have determined for liposuction surgery is an average of 5 liters, a maximum of 6 liters. As the mass of fat, the volume of fat we remove from the body increases. The risk of major complications definitely increases. Therefore, in fat removal surgeries, in liposuction surgeries, the main reason I avoid it for weight loss is to keep us safe from major complication risks. Therefore, if we generally know about human health, if we prioritize the well-being of the patient, and especially while helping the patient to achieve an aesthetically pleasing result, and if we can conscientiously assume the patient's obligations, responsibilities, if so, our chance of seeing these complication risks will be very low. Therefore, especially when you choose your surgeon, a doctor who will take too much fat, I do not believe it is the right course of action, in my personal view, to select a physician who plans to extract an excessive volume of fat from you. That is why you should have liposuction surgery not for the purpose of weight loss, but rather for the purpose of body sculpting, which will be more beneficial for both your aesthetic appearance and your overall health. If you wish to avoid complications, I recommend selecting physicians who are both diligent and possess a strong sense of ethical duty.